Hello and welcome to this presentation. Platform name is Blackboard Research and Foundation, and I will be your presenter today.
That's all about the tonometer. So I will discuss about another topic that is called color vision. Let's start. What is a color vision? Color vision is the ability of the eye and brain perceive the distinguish between different color in the visible spectrum of light. The human eye contains specialized cells called cones and which are responsible for detecting color. There are three types of cones, each sensitive to different range of wavelength of light: red, green, and blue. The signal from those cones are processed by the brain to create the perception of color. Color vision allowed us to differentiate between object and identifying pattern in the environment. It also plays an important role in activities such as art, fashion, and design. Some individuals have color vision deficiency, which can result in difficulty distinguish between certain color or perceiving colors at all. The most common type of color vision deficiency is red-green color blindness, which affecting about 8% of men and 0.5% of women Northern European descent. Other type of color vision deficiency include blue-yellow color blindness and that total color blindness, which is very rare. Light sensitive receptor. Light sensitive receptors are specialized cells or molecules that are able to respond to light stimulations and send signals to the brain, resulting in the perception of light or the regulations of physiological process. In the eyes, the photoreceptor cells located in the retina are the primary light sensitive receptors, detecting and converting light into electrical signals that are transmitted to the brain. The two types of photoreceptor cells in the retina are rod and cones, which are responsible for our ability to see in dimly lit conditions and to perceive color respectively. Other example of light sensitivity receptor outside of the eye include melanocyte skin cells, which can detect ultraviolet light using a photosensitive receptor, and certain neurons in the suprachiasmatic nucleus, which are involved in regulating the circadian rhythm in the responsible of the light stimulation. Type of cones. There are three types of cones in the human eye. A red cone, which account for 60% of all cones. Green cones, which are makes up 30% of the cones. Blue cones, which are limited into just 10% of the cones. The different type of the cones defect special range of light wavelength to allow us to perceive color. The human eye can distinguish between hundreds of different shades of colors based on the activity of these different types of cones. Color vision defects and deficiency. Color vision deficiency or color blindness refer to a group of conditions that affect the ability to perceive certain colors or shades of colors. The most common type of color vision deficiency is red-green color blindness, which affect the ability to distinguish between shades of the red and green. Blue-yellow color blindness and complete color blindness are other type of color vision deficiency through they are less common. Color vision deficiency can be inherited or acquired as a result of an eye disease or other underlying conditions, and while there is no cure, accommodation like special lens or filter may help to improve color perception for some people. Types of color vision. As I mentioned earlier, there are several types of color vision deficiency of color blindness. The most common form is red-green color blindness, which include two subtypes. Includes two subtypes, deuteranomally and protanomally. Deuteranomally, deutero deuteranomally makes it different to makes it difficult to distinguish between shades of green and red, while protonomaly makes it difficult to distinguish between shades of red and green, and include reduce the brightness of red color. Blue-yellow color blindness is another type of color vision deficiency which makes it hard to distinguish between blue, yellows and greens. Complete color blindness or achromatopism Achromatopsia is a rare and severe form of color vision deficiency, in which a person cannot see any colors at all and sees the world in shades of grey. Dichromacy. Dichromacy is a type of color vision deficiency where a person has only two functioning types of cone cells in their eyes instead of the usual three. Dichromates are individuals with dichromacy and they experience difficulty distinguishing certain color, particularly those in the green-red spectrum. There are different types of dichromacy, including protanopia, deuteranopia, and tritranopia, which affected the person's ability to perceive different color. Protanopia is a type of dichromacy that makes it difficult to see red color, while deuteranopia makes it hard to distinguish green color. Tritanopia, on the other hand, affects the ability to perceive blue color and is much less common than red-green color blindness. Protanopia. Protanopia is a type of dichromacy, which is a type of color vision deficiency. People with protanopia have a defect in the long wavelength cones L cones of their eyes, or they may be completely absent. As a result, they have difficult time seeing the color red and they may perceive it as either green, yellow, or gray. Protanopia is one of the most common type of color vision deficiency and is inherited in an X-linked X-linked pattern, meaning male are more likely to be affected than female. Deuteranopia. I see that in your previous message of you wrote protanopia instead of deuteranopia. Nevertheless, deuteranopia is a type of dichromacy characterized by the inability to distinguish between shades of green green and red. People with deuteranopia have deficiency of the medium wavelength cones, which are responsible for perceiving green light, and therefore they may have difficult distinguish blue, yellows, and green from red. This condition is often hereditary and affect males more frequently than female. There is no cure for deuteranopia, but corrective lenses and device that can enhance color contrast may help some people to better distinguish between color. Tritanopia. Tritanopia is a type of dichromacy which is a type of color vision deficiency. People with tritanopia are unable to perceive blue light due to a malfunction of absence of the short wavelength cones S cones in their eyes. This makes it difficult for them to distinguish between color in the blue-yellow spectrum and can cause them to see blue as green or yellow. Tritanopia is a rare form of the color blindness and is usually inherited in autosomal dominant pattern, which means it occurs equally in both male and female. There is no cure for tritanopia, but treatment like corrective lenses or tinted lenses may improve the color perception and in some causes, some cases. Problem in daily life. One specific problem that we will have color vision deficiency or color blindness may have faced in their daily lives in difficult distinguish between different colors, which can affect their ability to perform certain tasks. For example, they may have trouble identifying the ripeness or of fruits, matching clothes or accessories, or recognizing certain signal or signs. Additionally, people with color vision deficiency may face challenge in certain professions such as graphic design or electrical engineering, which required the ability to distinguish between different colors accurately. However, there are workarounds and accommodations available to help people with color vision deficiency overcome this challenge and achieve their goals. Test for color vision. Many tests are currently used to determine certain color visions are all very unpopular and reliability. Uh, reliability most commonly test Ishihara pseudo isochromatic plates, American optical plates, HRR test, the City University test, the Farnsworth Mansell's D15 test, the Farnsworth Mansell's 100 hues hue test, FM 100 hues, color arrangement test, the anomaly scope test. One most test for color vision is the Ishihara test, which used in a series of plates with color dots arranged in the specific pattern to test for red-green color deficiency. Another test is Farnsworth Mansell 100 hues test, which use color teal arranged in a specific order to test color confusion over the entire visible spectrum. Additionally, there are online color vision tests available that can be taken at home, such as the N-chroma color blindness test or color arrangement test. It's important to note that while those tests can give an indicator of color blindness, a proper diagnosis should be made by a healthcare professional such as optometrist and ophthalmologist. The Ishihara test uses uh, pseudochromatic plates. Ishihara pseudo isochromatic plates, which are images made of the colored dots arranged in the specific pattern to test for color vision deficiency, specific red-green deficiency. Those plates have been designed to be difficult or impossible for people with color vision deficiency to read the number or shapes depicted in the image, will allow those with normal color vision to see them certainly clear. The Ishihara test is one of the most widely used tests for red-green color blindness and use a series of these pseudo-isochromatic plates to determine the extent and type of color vision deficiency someone might have. Widely used and efficient test for red-green color deficiency test contain 38 plates, 25 number and 13 plates pathway. Of the 25th plates, one is the demonstrating of the visual tasks, 20 are for the red-green screen, and 4 are the classification of red-green cones deficiency. 3 plates intend for use the non-verbal subject. Dichromate and anomalous trichromates fails to distinguish the number. Slight protenopias and deuteranopias read some plates correct. American optical plates HRR test. As I mentioned earlier, the American Optical Company is known as for the production and pseudochromatic plates, pseudo-isochromatic plates, specifically the HRR Hardy, Rand and Rittel is full form of HRR plates. These plates are used for screening, grading and classifying the red-green color blindness. The company booklets pseudo-isochromatic plates for the testing color perception, containing a comprehensive collection of those plates, and is used by health care professionals to diagnose and treat people with color vision deficiency. Additionally, the American Optical Company has been a pioneer in the field of vision screening and continuing to produce high quality vision care product and tools. The American Optical Plates HRR test to identify proton, deuteron and triton defect and to grade their severity. Consist of 24 plates containing symbols and employ neutral colors. 4 introductory plates, 6th plate for color vision screening, and 14 plates for grading this severity or proton, deuteron and triton defects. Best for the defection of moderate or several triton defect. No possible or distinguish the dischromates and several anomalies trichomate. HRR plates for estimating the several of color deficiency and for titanate skin. The City University test. The City University color vision test is a type of pseudo-isochromatic plate test designed to detect the color vision deficiency, including red, green, and blue-yellow deficiency. It was developed by research at City University of London and is an alternative to the other popular color test such as the Sierra test and the Farnsworth Munsell 100 hues test. The City University color vision test is designed to work well with every kind of color deficiency observed and provides a simple and relevant screening tool for identifying color vision deficiency. Multiple versions of the test are available, including the third edition of the City University Color Vision Test, which display normal pattern, normal pattern, toten, deuterone, and tritone color, with differentiation being strong in the red-green range. Farnsworth Munsell's D15 test. As I mentioned earlier, Farnsworth-Munsell's D15 test is a type of the color vision test that is used to screen for color vision deficiency. It is a subset of the well-known Farnsworth-Munsell 100 hues test and is designed to be a shorter and simpler version of the test that is better suited for use in clinical settings. Farnsworth-Munsell D15 test consists of 15 loose caps and one fixed cap. The reference cap in one walls. Each cap's hues is chosen so that adjacent caps have approximately equal difference. If caps are arranged in order out of their box form a hues circle to dated. Standard D15 test divided people into two groups: people with normal color vision and slightly color deficiency people. The people with moderate and several color vision deficiency. The D15 test consists of a tray with 15 colored discs that have to be arranged in the correct order by the test taker. The test is designed to test a person's ability to differentiation between hues and is used to identify different type of color vision deficiency, including red, green, and blue-yellow deficiency. The D15 test is often used in combination with other color vision tests to help diagnose and treat color vision deficiency. Typical result obtained an congenital protein deuterone adenine color deficiency, not designed for screening. It separates sufficiently affected deuterons from protons, sufficiently affected deuteron and moderate proton. Anomaloscope test. An anomaloscope is an instrument and color vision test used to diagnose and characteristic color blindness. In this test, two different light sources are presented to the individual and they must be matched to the same color. The Nagel's anomaloscope is a well-known reference test used for identifying the classifying red green color deficiency in particular. The anomaloscope test is often used in conjunction with other color vision tests to provide a comprehensive diagnosis of color vision defects. It is considered the standard instrument for diagnosis color vision defects and is often used by eye care professional. Enhancing the color defect performance. There are various methods and tools available for enhancing the color defect performance. Some appropriate includes the use of color vision correction glasses or lenses, such enhanced glasses which aim to enhance color perception by sensitively filtering certain wavelength of light. Other approach includes a color vision therapy program that involves specialized training and exercise to help the individual with color vision deficiency learn to distinguish different color more effectively. Additionally, there are computer software programs and apps available the offer color correction features and the ability and to adjust color setting to improve legibility and contrast for the individual with color vision deficiencies. However, it's important to keep in mind that the effectiveness of this method may vary depends on the individual particular color vision deficiency and other facts, so it's important to consult with a healthcare professional for personalized advice and recommendations. There are several factors that can affect color vision includes. First one, lightning. The color of the light source can affect the perception of the color as difficult light source emit different combinations of wavelength. Age. Number 2. As we age, our eyes, lens and other structures may change, affected color perception. Number 3. Color blindness. People with color vision deficiency may have difficulty perceiving certain hues or distinguished between certain color. Number 4. Disease. Some medical conditions such as diabetes, sickly cells anemia and macular degeneration can affect color vision. Number 5. Medication. Some medications or drugs can cause change in color vision as a side effect. Genetics. Number 6. Some individuals may have inherited genetic mutation that affected color perception. It's worth nothing that the effect of those factors on color vision can vary widely between individuals, and some people may be more susceptible to certain factors than others. Types of color vision deficiency. There are several types of color vision deficiency include first one, red green color blindness. This is the most common form of color blindness and can be further subdivided into protanopia, complete loss of red cone cells, and deuteranopia, complete loss of the green cone cells. Number 2. Blue-yellow color blindness, also known as tritanopia or tritanopia. This is a rare form of color blindness that affected the blue-yellow color spectrum. Number 3. Completely color blindness, also known as achromatopsia. This is a rare and severe form of color blindness in which a person cannot perceive any color at all. Partial color blindness, also known as anomalous trichromacy. Number 4. This is a less severe form of color blindness, where a person may have difficulty distinguish certain color or shades. It is important to note that this specific type of color deficiency can vary widely between individuals, and the severity of the condition can also vary. Additionally, some people may have a more mild or subtly form of color vision deficiency that does not necessarily fit into one of these broad categories. Achromatopsia is a rare and severe form of color blindness in which a person cannot perceive any colors at all. It is also known as total color blindness. Individuals with achromatopsia typically have poor visual acuity, photophobia, sensitivity to light, and nystagmus, involuntary eye movement, and a complete absence of color vision. The condition is usually genetic and color currently has no cure. However, there are various treatment and uh, assistive technology such as specific glasses and contact lenses that can improve vision and quality of life for the individual with achromatopsia. Some view with and without color vision. First one is trichromacy, and second one picture I will show dichromacy, and the third one I will show monochromacy. Acquired color blindness. Acquired color blindness, also known as acquired color vision deficiency, is a type of color blindness that developed later in life as a result of certain disease medication or as a result of aging. This is condition typically affected both men and women equal and can be caused by conditions such as diabetes, uh, glaucoma, Alzheimer's disease, and or certain medication. Acquired color blindness can have a variety of symptoms ranging from mild difficulty distinguish certain color to complete color blindness. It is important to consult a healthcare professional if you experience change in your vision or color perception. So that's all about my slides, and today I will discard. Thank you for watching my video.
Thank you for watching my video.